So Dr. Engel, I have seen the way that you talk to your patients. I've heard the way that you've talked to your patients, the way that you care for them. Everybody comments on how they feel after they meet you. And I'm just wondering, where does that compassion come from?
Well, I think to have compassion, you have to really care for people because they'll sense it. And I do. I love people. I think the perspective of having compassion comes from a happy individual, and I'm a happy guy. So that would be first. But displaying compassion should just actually come naturally. And when a professional or a doctor is put into a position where they get to care about others or care for others, when the patients acknowledge that the doctor's compassionate, it's great for everybody. The interactions between the patient and the doctor is natural and honest, and I believe that a lot of my patients really know who I am. They respect my professionalism, but they also know that they get me as a person as well. Sometimes when patients come in for the first time, they'll say, I don't know you, but I trust you. And that's really neat. That's really important. When the patients come in, the most important thing for me is that they leave here feeling like they understood me, they understood their needs.
So it seems like everybody who leaves here has already made another appointment and they're looking forward to coming back. So what do you attribute that to?
Well, I think that there's a few really important factors. One, I think that you have to be able to recognize the problem. So if you come into my practice, I have to be able to look at your scenario, look in your mouth, look at your radiographs, and I have to be able to, almost without you telling me, understand what I see and what your needs are. And then the second thing, which is equally as important, is one has to be pretty well versed to give you, as the patient, the options. Because dentistry is very different now. We are in a time where we use a lot of technology. There are a lot of options, and there's a lot of comfortable options. The other thing is, one of the main complaints that a dental patient has, besides all the other stuff, is that they feel like they don't have control. Like they're told what to do, they do it. And there's a lot of things about that that are wrong. I feel if you give a patient 3 options for any type of treatment, if they exist, and allow them to make their own decision, I feel they feel like they're in control. And that's important. I will, of course, always guide them on what I feel is best, but if I provide one of those 3 options, I feel that any of those will work. And then the last part of it, the third part of it, is when you agree to a certain type of care, regardless of the cost, the practitioner has to really be able to deliver the care. And if he or she can't, then a referral may be in order. So that's kind of my 3 main pieces, and I think that that's also what makes patients feel very comfortable and want to commit to care.
What would you say to someone who's in a denture and thinks that they have no options, and so they don't visit the dentist because they're in a denture and they feel that that's the last of the care? What would you say to them?
Well, in a majority of cases, it's not. A denture patient or a patient without teeth typically is facing 2 concerns. One, are they financially able to invest in the mouth to have teeth? And we understand that. And there's a lot of options there. And a lot of them are very affordable. And a lot of patients don't know that because they assume they have to stay like that. So they don't inquire, so to speak. The second part about that is it's better for a patient to look into options earlier versus later. Because if a patient is missing teeth, as time goes on, things change in the mouth and those options become fewer and actually way more costly. So even if it's just an inquiry about like, hey, what can I do? I have missing teeth or I have a denture, it's loose, I can't eat anything. I go to functions and I don't feel like a human, or I can't smile, I cover my smile. at minimum, I think you owe it to yourself to just inquire about what can I do.
So, and my last question for you, Dr. Engel, is that we know that you're an educator. You have your own training institute and you've taught all around the world, and that's very successful for you. And then I want to know, how does that play into your private practice, into the dental center?
Yes, that's a great question. I think there's a couple ways to look at it. For me, it plays in that I get to constantly stay on the edge of education. As an instructor, bringing it to my colleagues and teaching them some of the things that I do, I have to stay up on the latest and the greatest. And not only just purchase the latest and the greatest or buy equipment, but I have to be very knowledgeable on all of it because I have to teach it. So this gives me the opportunity to remove the things that I don't think I need or maybe not be conducive for my practice, and implement those that are and do. And there's a lot of things that go into that. I try to minimize cost for the patients with certain technology. I try to make things more conservative. I try to plan ahead. There's a lot of things that I do that I could see the end result before I start. And that's, again, technology based. So the way that we kind of bring them together is we get to bring all of the technology forefront to the practice and implement that on all of our wonderful patients. And they get to leave with the benefit of knowing that it's well thought out. I've spent years in learning all of this stuff. And the procedure that they had here is often way more conservative and comfortable than it would be maybe done in a different way. So we're really excited that we get to bring the latest and the greatest. And we're also still very, very critical of our own results. We want excellence, and that's what we shoot for every minute of the day. Not only with me, but my whole team. My team is wonderful, and they know their duty is to be caring and compassionate for everybody. And so I try to lead by example, and I think we've done a pretty good job.